Coronaviruses are a large family of viruses that causes illness ranging from common cold to more severe diseases. A novel coronavirus is a new strain that is now identified in humans. The disease caused by the novel coronavirus, first identified in Wuhan, China, has now been coronavirus disease since 2019 December. It's very easy to remember. COVID-19. CO stands for corona, VI stands for virus, and D stands for diseases. Coronavirus are zoonotic, meaning they are transmitted between animals and people. The fast spread of coronavirus, now called COVID-19, has sparked alarm worldwide. The World Health Organization has declared a global health emergencies, and many countries are fighting with a rise in confirmed cases. The Center for Disease Control and Prevention, that CDC, is advising people to be prepared for disturbances to daily life that will be necessary if the coronavirus spreads within the communities. The virus is transmitted through direct contact with respiratory droplets of an infected person, through coughing, sneezing, or touching surfaces which are contaminated with virus. The COVID-19 virus may survive on these surfaces for several hours. But important thing is, simple disinfectant can kill it. Symptoms may include sore throat, headache, fever, cough, shortness of breath. In more severe cases, infection can cause pneumonia or breathing difficulties. More rarely, the disease can be critical. These symptoms are similar to the flu or influenza or common cold, which are a lot more common than coronavirus. This is why testing is required to confirm if someone is affected with this disease or not. It's very important to understand what is incubation period. Incubation period means time from exposure of the infection to the development of disease, which is currently for coronavirus between 2nd day to 14 days. By saying so, it also means that if you are infected with coronavirus today, it is not necessary that the signs and symptoms will come today only. It can come anytime from 2nd day to 14 days. Since this is a new virus to us as well, we are not very sure who's at risk and who's not at risk at all. But the current cases confirmed who are affected with the disease are mostly people above 80. If we are talking about the gender, men are more affected than women, and people who have underlying comorbidities like cardiovascular diseases, heart problems, blood pressure, diabetes are at more risk than any other persons. Unfortunately, there is no specific antiviral treatment at present for this new coronavirus. Treatment is therefore supportive, which means giving fluids, medicines to reduce fever, and in severe cases, oxygen may be required. People who become critically ill from this virus may need a respiratory support as well to breathe. Bacterial infection can complicate this virus. Patient may require antibiotic as well. There is no evidence that supplements such as vitamin C or probiotics will help speedy recovery. The use of medical mask is advised if you have respiratory symptoms like coughing or sneezing, so that you can protect others as well. If you don't have any such symptoms, then there is no need to wear a mask. If masks are worn, they must be used and disposed of properly to ensure their effectiveness and to avoid any further risk of transmitting the virus to others. The basic precautions you and your family can take to avoid infection. 1. Wash your hands frequently with soap and water for at least 20 seconds or an alcohol-based hand rub, which is normally available at any pharmacy. Cover your mouth and nose with a flexed elbow Or if you're using tissue, when coughing or sneezing, throw away the tissue in a closed bin. Avoid close contact with anyone who has cold or flu-like symptoms. Seek medical care early if you or your child or family member or friend have a symptom like fever, cough, or difficulty breathing. Most importantly, stay home if you are not keeping well. Take proper precautions during this epidemic. Have a regular checkup with your primary physician, and if you're not keeping well, then immediately visit to your nearest Prime Medical Center, because at Prime, we treat our patients with personalized care personally.